Today I'm going to talk about Ebola. I'm going to talk about what it is, the signs and the symptoms, and how it's transmitted. I'm going to talk about why at-risk people for having Ebola should be quarantined. I'm also going to talk about the reasons that people have given for why quarantine is bad for possibly infected people. During this recent outbreak of Ebola, 2,431 people out of 4,655 have died, according to LiveScience.com. That puts the mortality rate at around 50%. So what is Ebola? The CDC website states that Ebola has been known as the Ebola hemorrhagic fever. It's a rare and deadly disease caused by an infection by the Ebola virus strand. There are 5 strands total. That's the actual strand. The Ebola virus was first discovered in 1976 by the Ebola River in what now is called the Democratic Republic of the Congo. In this picture, I marked the location of the Ebola River with that star. As you can see from the picture, the river is quite small and it's in a relatively small area of Congo. The outbreaks have sporadically been in Africa. The main locations with widespread transmission are in this picture. It's Guinea, Sierra Leone, and Liberia. The darker the orange, the more dense the Ebola virus is in that location. Locations without widespread transmission are places like Mali, Spain, and the United States. With that being said, the CDC has stated that there's only 3 confirmed cases in the United States. Signs and symptoms of Ebola include fever, a severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained hemorrhaging. A hemorrhage is bruising or bleeding. Symptoms may appear anywhere between 2 to 21 days after exposure, and the average is about 8 to 10 days. People who recover from Ebola have antibodies for around 10 years. Ebola is transmitted through direct contact. That means that body fluids such as blood, saliva, mucus, vomit, urine, or feces from an infected person who can either be dead or alive touches the eyes, nose, mouth, or open cut, wound, or abrasion on a non-infected individual. Ebola can survive on dry surfaces such as counters and doorknobs for several hours. The virus can survive in the blood outside of the body for several days. Now that I've explained transmission, it's pretty scary. Now think about flying on an airplane with someone, and although it's really gross, you go to the bathroom after them and they accidentally peed on the seat or got a little on the seat, and you sat in it. Or you picked up a nasty tissue and that person happened to have Ebola and you wiped your nose without thinking about it. Or your family member goes to Africa to help and do their medical duty, and then they come home and they resume their normal lives and they kiss you and they touch doorknobs and counters, or they accidentally get pee on their hands and they touch you or something. I know it's gross, but that stuff can happen. If I was possibly infected, it wouldn't be a second thought in my mind to go into quarantine. I want to make sure that all my family, friends, and fellow Americans don't get sick, even if I got sick. I find that the complainers about the quarantine are just being really selfish. It's okay to go over to Africa and to help out there, but coming home, they don't care about risks of possibly infecting anyone in their lives. If I was a business owner and someone possibly had Ebola, I would find a way for them to keep their job while in quarantine, because I would feel like they were doing the right thing to be quarantined. So while over helping in Africa, people wear hazmat suits. As you can see in the picture, it covers every inch of that person's body. It makes sure that they don't get sick, but things happen. They could take off their mask, not around the infected people, and drink some water. But stuff happens, and they could get infected without even realizing it. They don't live in these, they don't sleep in these. Something could happen. So why would we risk having someone who's possibly infected infect others? It's called being proactive. An article on thedailybeast.com speaks about a nurse named Casey Hitchcox. She said that her human rights have been violated while she seemed powerless to fight her quarantine. An article on MSNBC states that the mandatory 21-day quarantine may be good politics, but it discourages healthcare workers to go and help fight the epidemic. In that same article, Dr. Art Renegold, the head of epidemiology in the University of California, states that he doesn't think quarantine has an added benefit in terms of health. He also states that it won't make a difference in the amount of cases of Ebola in the United States. Although I'm not an expert, I don't really see how that makes sense. How would quarantining a possibly infected person hurt? Why wouldn't it help? You're putting those people away from the general public and in terms stopping the spread of the disease. In conclusion, I find that the positives for quarantining people would help keep the outbreak from forming in the United States. Although I know Africa needs help, and I'm not discouraging that at all, let's not forget about our citizens and ourselves and make sure that we don't get sick in the process.